us something about the conference.
Very good morning to everyone. So we have on the dais Dr. Srikant, Dr. Bharti, and Dr. Upadhyay is going to join us very soon. Professor Chaturvedi and Professor Neil Bhavesh. We also have distinguished speakers in this hall. Rama ma'am is here, and other distinguished speakers from CCRS. I welcome them all. So about this conference, the brief is that from Center of Excellence, which was awarded by the Ministry of Ayush, this is a mandate that whatever work we are doing, it should be disseminated among the researchers as well. So if you look at the keywords, you have Am and Soth. These are the two keywords which are the focus of this conference. In Ayurveda, you might be knowing that Am is represented by the toxins or the free radicals which are generated in our body, and mostly it is related to the imbalance or non-functioning of the proper Agni. And that is how the undigested food or these toxins are created in our body. But if you talk about the modern medicine or the modern science, if there is a disbalance or any changes in the metabolic pathway or the digestion, it is going to create several entities or several molecules, not only in the body, but at a tissue level, at a cell level. So how these toxins or free radicals are being created in our body, the concept is already in Ayurveda, but now we know that unless we involve the technological advancements, the modern methods, if you want to have the understanding at higher resolution, you have to have these technology to see what is happening at the micro level or nano level. And then it will be an evidence for the concepts what we have in Ayurveda. So that is one goal of our project, to work on this area and development for the developing the evidence as well as understanding the complex nature of Soth and Am both. Soth, you might be knowing, is related to inflammation. And if you talk about chronic disease, I am not aware of any chronic disease which is not related with the Soth. In almost all chronic diseases, you will find the involvement of Soth or the inflammation. All the diseases currently which is prevalent, whether it is cancer or the project is focused on rheumatoid arthritis. So that is going to be a major part to work on all the inflammatory mechanisms. And our team, Professor Rupesh and Professor Neil Bhavesh, Dr. Hemant, Dr. Pallavi, I am very much thankful that the team has all the expertise, whatever we needed, for working out on these two concepts and see the correlation and how we can generate enough data, because unless we generate the data based on the tested methodology, it will be very difficult to convince the scientific community. So that is one important goal of this project on which we are working on. So with this, I am very much thankful to all the dignitaries on the dais and off the dais and all the delegates who have come here to join this conference, and the students and researchers for their presence. And I hope that after one day of this deliberation, you will find an enhanced learning, at least in these two respects, of Am and Soth. What are the concepts in Ayurveda, where we have experts from the CCRS and Ayurvedic fields who will be delivering the lectures specifically. And also we have scientists from the modern medicine, they will try to explain these two concepts, whatever information we have in the modern science. So with this brief note, once again, welcome you all. Thank you very much.
Thank you so much, sir. Now I would like to invite Dr. Narayanam Srikanth for inaugural address about COE program and CCRAS perspective.
Sir, good morning everybody. Ajnanatimirandasya jnananjana salakaya tasmat unmili netrasya tasmai Sri Gurave Namaha. This is a wonderful occasion, but JNU, ICGEB and CCRAS are conducting this wonderful workshop, and also followed by various training programs as an integral part of Center of Excellence program. As we know, this is the era of the transdisciplinary research, and it is very, very essential to understand the language of the Indian knowledge systems, whatever they have been documented thousands of years ago, to in a scientific language for their better understanding. And we always use various words like we are validating the science and all. But we are not validating, my opinion, we are understanding the whatever there is the scientific information embodied in the Indian knowledge systems in a better language which this era can understand. That's very, very important. And realizing this, actually, since last few years, I think with JNU at least, we have collaboration since last 5 to 6 years. We have been actively collaborating with JNU and various to understand the fundamental principles of Ayurveda. And we have been, I think, successful, and we have been taking forward these efforts in a more vigorously, and expanding the scope of understanding the basic principles of Ayurveda, right, starting from the Prakriti and the host immune responses, and also understanding the disease pathogenesis and various issues. And still we are conceptualizing various issues of how to understand Kriya Kalas, how to understand the antimicrobial resistance, and all various issues are in mind, and we have been, I think, taking forward one by one and understanding these aspects. And this is this particularly this workshop we have been conducting particularly in Ama and Shotha. That is that to understand how we can better present and how better interpret and all. This is one. Second one, the Center of Excellence also we have been, the Minister of Ayush has given particularly on the systems biology approach to Ayurveda. That is also very, very important. That also some aspects of understanding of the disease pathogenesis and in relation to various things, that is also being understood particularly in the context of rheumatoid arthritis, that is also been taking. Particularly here, the today's context, the Ama and Sodha, which is very, very important aspects of basically, then we know that these are the two things which are actually very, very, very much interrelated each things, because the entire body systems are actually managed by the three doshas that it's very aware, that is Vata, Pitta and Kapha. And whatever, it is also actually balancing the entire, causing the homeostasis of the body systems. Homeostasis of the body systems are maintained by the these three. That we know that Visargadana Vikshepai Somasurya Anilayadha Dharayanti Jagadeham Kafapitta Anilastada. How actually it is being actually put the body physiology in the homeostasis status, and health is being achieved. This is the important. And to understand this, the importance of Ama, it is very, very important to understand the concept of Pitta. If the first ever efforts have been made, actually, it's not first ever, there several efforts have been made, but it is a written documented, Professor C. Dwarakanath has written in a book called Introduction to Kaya Chikitsa in 1950s, and the based on the available knowledge of the contemporary physiology and I think biochemistry and whatever there in 50s early, and he has nicely interpreted what is the concept of ama and what is the concept of three doshas, what is the concept of kalas, what is the various aspects very nicely interpreted, and how the metabolism and biotransformation of the things which are happening in the body, and he nicely collated and presented for the understanding of the contemporary scientific communities. He very clearly told that this is pachati rupantare. That's what it is. It is not only the digestion; it is also biotransformation. It is rupantare. That's why where ama is one of the important entity which is mentioned in Ayurveda, which is due to the malfunction of these factors of the Agni, particularly the Pitta, which is responsible for creating this type of and which is precursor of various diseases, and there are various syndromes which is very clearly mentioned by ama. What happens if ama actually the systems, they are the various manifestations of ama, that's very, very clearly told in Ayurveda, which is a root cause of various diseases. It is it is clearly told that in a sloka that srotoroda balabramshe gaurava anila mudata alasya bhakti nishtiva malasanga aruchiklama lingam malanam samanam niramanam viparya. It is simply given. But there are the various implications of each and everything. I am not going to explain how the channels and the molecular pathways and how it works and all. Srotoroda, it is not only simply obstructing the channels and all. There are the various pathways in the body and various mechanisms in the body which are responsible for the metabolism and all. Then this here, if we want to see the health and disease, both aspects, it's very, very important. If you see the definition of the body in Ayurveda and what it is what is its relation with Agni and Ama, it is very clearly, it is a body, it is very clearly told it is a product of the nutrition. How actually, what Ayurveda says, chiyate annadhibhikaya. Whatever we are taking something, it is being metabolized and body is continuously growing. And the process of anabolism, dihyate vardhate iti deha. It is always an anabolic phenomena that body is growing by virtue of the nutrition. But how the catabolism, where it is happening is siryate anena iti sariram. But sarira, which is given, which is actually always some cells are being degraded and new cells are coming. That's why anabolism, catabolism and nutrition. It is a very, very, very comprehensive understanding of the body and how it is being sustained. It is very clearly told where the concept of ama, it is more relevant particularly here because how in between how it is responsible for the various pathogens of various diseases. It's very, very important. It is also then we see that particularly in the contemporary immunology, it is very, very important to understand ama and Shotha, and because both are interrelated sometimes, and also inflammation is the precursor of various diseases and all, and how we can better interpret in the immunological perspective and all, how various factors which are causing ama and how it is causing the diseases is still need to be understood in the modern molecular biology perspectives, and immunological perspective is very, very important. And in this, and while understanding this, it is also very, very important various other aspects which actually trigger these things, and how the autoimmune diseases, particularly rheumatoid arthritis, psoriasis, SLE and all, how we can evaluate, if you understand the concept of ama and autoimmunity, how we can manage this and how we can prevent, how we can manage actually, how we can reduce the morbidity, particularly in the in autoimmune diseases like rheumatoid arthritis, which is the still an unmet need actually, particularly in the medicine. That's why the things how we need to better understand what is Pitta Dara Kala, how it is functioning, and how the ama is being produced, and how ama is whether ama is related to only the costa, or ama is actually can be produced at different entities in the body, and what is its pathway, how can we prevent. These are the various things we still need to understand, and these things we need to understand for the prevention and management, but evolving a new strategies, particularly in the management of autoimmune diseases. That's why still we are understanding this. The concepts which we have seen in early 2000s or something, and the concept of how the mucosal gut-related the mucoid tissues and mucosal associated lymphoid tissues, and how antigens are presenting, what is the oral tolerance. Various concepts came into the things, and how that the food whatever we are taking, what drugs what we are taking, how they are being actually, sometimes they may cause the reactions. Sometimes they cause the issues and allergic diseases, and sometimes they will abort and they don't cause and all. What is the relation? Excellent studies have been conducted in the modern immunology, which is very, very important in the context of Pitta Dhara Kala, how antigen is presenting and how it is reacting to the body, how it is causing the disease. Sometimes it may not cause due to the various immunological mechanism. I need not actually put here. It is your subject, and these are the aspects where we can take some essence of these immunological mechanisms, and we can correlate to the ama and viruddhahara, and incompatible combinations of foods which may cause the various inflammations, various diseases, and also cause the ama in the body, and it may cause the diseases. This entire mechanism, dehadhatu prachanika bhutadravyani dosha prakopam apadyanti. This may be the external factors which may actually cause the prachanika bhutadravya. Sometimes they cause, the body itself may produce the autoantibodies and the antigens, and it also causes a disease. And the mechanisms we need to better understand, and where we can prevent and where we can manage. This is the Ayurveda offers an excellent solution and excellent things and all. The concept of Prakriti Vighata, which is changing the internal environment of the body to cope up with the diseases, is an excellent proposition. Though it is mentioned in the context of Krimi Chikitsa, we can better interpret how we can, the Prakriti Vighata can be actually a good strategy for managing the autoimmune diseases like rheumatoid arthritis, and how how the internal environment of the body can be modulated to cope with this such diseases. And these are the various concepts which we need to better understand. But for that, we need to have an excellent idea about the modern immunology. And we also need the good idea of the molecular biology and other contemporary sciences is very, very important. That's why JNU, I think, I think we CCRS particularly, and Minister of Ayush extend this actually complement the efforts put in by the JNU, particularly for initiating Ayurveda biology program, and also taking various studies and join hands with CCRS, particularly in understanding the molecular signatures of the Prakriti through multiomics and other things, and also various studies to understand the host immune responses and its relation to the Prakriti, particularly a study which is going now, excellent study. Particularly we take an example of H. pylori and Mycobacterium tuberculosis, and how these are various issues, how Prakriti and other things which are actually responsible for the disease susceptibility, and taking few examples. These are all various aspects we need to still understand, particularly. That's why such type of workshops are very, very essential. and particularly under the COE, these efforts are being made. And I also want to put few more important, one or two more studies we are taking with other institutes like Rajiv Gandhi Center for Biotechnology and ICMR Institute at Bhubaneswar. Also some more studies how the mitochondrial functions and gene expressions, particularly to the understand the longevity in relation to the Prakriti and all. And something Prakriti, inheritance of the Prakriti, epigenetic and genetic basis to understand, particularly in Trivandrum we are taking, and we are taking 3 generations of the population, which are actually from the current generation, their parents and grandparents who are alive. We are assessing particularly in the Prakriti in various, in particular area, particularly in Kerala, in particular geographical region where the dietary and other lifestyles are similar, and we are taking dietary recall from them, and 3 generations we are understanding, and this is also very good picture how the Prakriti is inherited and what diseases how are being actually inherited according to the Prakriti, and we are trying to understand. It is a pilot study, though it is a pilot, it is very huge study we are taking, and 3 generations they should be alive, and we have to take their Prakriti assessment done. And for all this, the important basis is we CCRS have the validated format, validated approach for the Prakriti assessment, which is scientifically done. That is being taken as a baseline, and all these studies we have been doing. And these studies will really, I think the outcomes of these studies will really help us to understand the role of Prakriti and role of and other factors, and other factors which are contributing, diet, environment, lifestyle, how they are really contributing to the disease prevention as well as the management of disease, and how we can reduce the morbidity also. These are the few things we have been understanding from all these projects which are being collaborated with JNU and other things, and I think we will do some more and more projects with the scientific institutions like JNU and even IISA also. We are being collaborating various studies, particularly in one COE is already given by Minister of Ayush in collaboration with our CCRS Institute at Bangalore, and I think some more projects on diabetes and its efficacy also being taken with Indian Institute of Science also. And various studies we have been taking. I think these fundamental principles, understanding the fundamental principles, and will really be helpful. And this is not only fundamental studies, these are immediately has a clinical relevance and application in the clinical practice. And that's why these are very, very important. And finally, these, I think such understandings will give us a very good strategy, particularly to understand, prevent, and particularly manage the various autoimmune disorders which are currently which are really challenging and having a more burden. Now it is coming, and I think we will enjoy this workshop today, and very good lectures we have. We have Professor Rama Jayasundar Madam is there, Dr. Bhavana is there, Dr. Deepak, various other experts. We will listen to them and understand better, and others. Followed by this, some training is also there for 7 days, and the techniques and all they are learning, and this will help particularly CCRAs and other scholars to take forward make their career and take further studies. Thank you very much, sir. Thank you.
Thank you so much, sir, for that perspective. Now I would invite Dr. Bharti for the inaugural address.
Thanks a lot.
I would request Professor Rana Pratap Singh to welcome Dr. Kaustubh Upadhyay, Advisor, Ministry of Ayush, Government of India. Thank you, sir.
Respected Dr. Kaustubh Upadhyay, Advisor from Ministry of Ayush, Professor Rupesh Chaturvedi, Professor Rana Pratap Singh, Dr. Neil Srover Bhavesh, our beloved Deputy Director General, Dr. N. Shrikant. My dear friends, I first of all thank you all for giving me this opportunity to address this gathering. I will like to congratulate Professor Rupesh Chaturvedi, Professor Dr. Neil Srover Bhavesh, and the team for creating this Center of Excellence at JNU in association with Ayurveda Fraternity. I mean, they have taken it from grant from Ministry of Ayush, and it was a good idea to develop this kind of Center of Excellence where the Ayurvedic medicines can be studied for their mode of actions. So it's basically a very generous job, and the special emphasis has been laid on the rheumatoid arthritis. The drugs being used in rheumatoid arthritis, as Dr. N. Shrikant has elaborately discussed, in Ayurveda it is described as Vata. So, as you know, rheumatoid arthritis is an autoimmune disease. Unlike other joint diseases which may be degenerative or something, it is a autoimmune disease. कारण ही समझ में नहीं आता क्या हो गया young age में. Young age girls, young age people are involved, a girl of 20 years, 25 years, and the clinical picture is pathetic. All the joints, multiple joints are involved, symmetrical joints are involved, there is morning stiffness. Patient cannot do the normal routine activities when there is exacerbation. It's a chronic disease. There are intermittent remissions and exacerbations. So when the disease is flared up, so patient is around crippled, and is to bed only for weeks together. And when the disease is subsided, the patient may do certain jobs, certain routine works of life. However, there are deformities in later stages, as it is a chronic disease. Patient के हाथ टेढ़े हो जाते हैं, ऐसे button ear deformity हो जाती है, button नहीं लगा सकते, उंगलियां सूज जाती हैं, like this. This is the picture is very, very pathetic. And lots of patients are coming to Ayurveda and getting treated here. So we have thousands of hospitals and lots of arthritis patients, especially rheumatoid arthritis patients, are getting relief. So what actually the Ayurvedic medicines are doing with the patient, that has to be understood. And what is the concept of, as Dr. N. Shrikant told, what is the concept of Ayurveda? How Ayurveda describes the disease? It's the autoimmune disease, yes, but Ayurveda says it's a disease of ama. Now it has its own language. Ayurveda has its own way of describing things. What is ama? Ama is perhaps some antigen from gut, from GIT, some indigestion, some certain things are causing ama. If we are not regular in eating, we have not regular eating habits, we are taking more of fatty food, we are not doing proper exercises, sleeping in day and awaking in night. These are the predisposing factors to this gut pathology. And how this creates this, how this antigen creates antibodies, and that antigen-antibody complex that settles in the joints, how this creates a systemic disease, because it is not only limited to limited number of joints. It goes to the whole body. There is a type of fever, feverish feeling, heaviness, like loss of appetite. Patient is feeling very weak, very in a very poor look, है ना, and toxic look. इस तरह से लगता है. Patient is having no appetite, no digestion. There is refractory anemia. Patient is anemic. You keep on giving iron, but iron is not responding to the patient. So this type of patients are there, and symmetrical joints are involved, both knees, both ankles, both hand, both fingers, these all small fingers even, and all those things are there. So this is just I'm giving the situation how pathetic the picture is. And now what the Ayurveda is doing, we are doing first arm pachan. First we are doing, if Dr. Shrikant told, if there is Gaura, Vanil, Murta, there are features of Sama and Nirama. When the Ama is there, so when we are treating the patient, first we are doing some arm pachan, giving certain decoctions, herbal decoctions and certain medicines, chitrak, etc., which are doing arm pachan, which are removing this gut antigen problem, and which are improving your digestive capacity, which are improving your enzyme system. And then later we are also treating the disease. Now for the disease we are giving certain anti-inflammatory drugs. Of course in modern medicine people may think it is anti-inflammatory, but they may have certain other actions also. Those other actions have to be found out. First of all, we have got Shunthi Gugul Godanti, and Shunthi Gugul Godanti has been patented by CCRS also. So for this particular center of excellence, CCRS has given Shunthi Gugul Godanti for study, and also Rasna Saptakvat. Rasna Saptakvat is having certain ingredients, like there is Rasna, Rasna is called Plukia lanceolata, and Gokshuru, that is Tribulus terrestris. There is Goduchi, that is Tinospora cordifolia. There is Borevia diffusa. There is Ricinus communis, errand, that is Cedrus Ciodara, Devdaru. There is Cassia fistula. There is Gingiber officinalis in this product. So this decoction is very well utilized and accepted by the patients of rheumatoid arthritis, and they get clinical relief a lot. So this particular center will be studying the mode of action of these drugs. So there are three components. One is to characterization of formulations. The formulations we have provided are being characterized by NMR by Professor Dr. Neil Sarovar Bhavesh, and Professor Rana Pratap Singh is creating animal models. They are creating arthritis to rats and other animals, and they are seeing the efficacy of the drugs to these, giving decoctions and all. And Professor Rupesh Chaturvedi is analyzing the mode of actions of these drugs. So this is how this center of excellence is working. And if we come out with certain things, definitely we will be able to explain how these medicines are effective. So it will definitely open better dimensions to not only to modern fraternity but also to Ayurveda. We will be able to understand in better ways how our medicines are working. And modern people, allopathic people, will also come to know how certain drugs can change the quality of life of our rheumatoid arthritis patients. So there are certain Google preparations in Ayurveda. There are certain Rasna, Arand and other decoctions. There are certain Singhnath Gugul is the drug of choice. Singhnath Gugul is a combination. Now it's a combination of many drugs which we have not given here, but we are practicing it successfully in the patients of Amvata. And there are certain disease modifying things, like modern medicine is also using now gold preparations, gold and penicillamine for as a disease modifying drug for rheumatoid arthritis. Now, how the Ayurvedic drugs act, we have also certain ras and rasayan drugs which may act as disease modifying drugs. So these may come in the later stages. First, we are initiating with certain drugs and trying to find out the mode of action. So it is very, very important in view of research. It may be a real research in the future, and sir has really made a very good group for studying all these things, and sometimes they are really reaching our hospital also, and they discussed how the patients are coming, what is the real load of patients of arthritis, however, and they talked to our officers and doctors. There was an intensive talk and how the drugs are acting, what is the belief and what is the confidence level of a doctor of Ayurveda for using which are the drugs of choices. And like that, we have been able to conclude that we should initiate our study with Shunthi Gugul and Rasna Saptakwat. These are the two things which are being studied over here. One more drug is there. So these are being done at this Center of Excellence. And 1 year has passed, and this is the first seminar of its kind at ICGEB. Here, this is a multicentric, this one. This involves School of Biotechnology also, School of Genetic Engineering and Central Council for Research also. And in future, we will come out with better things, with better study results also will be discussed, and we can give more and more inputs in the future. It is just to start with. So I wish you all a great success, and I again thank Professor Rupesh Chaturvedi, Professor Rana Pratap Singh, and Dr. Neil Sarovar Bhavesh for all this. Thank you, sir.
Thank you so much, ma'am. Now I would request Dr. Kaustubh Upadhyay for the special address.
रागादि रोगान सत्तान शक्तान अशेषकाय प्रस्थान अशेषान औत्सुक्य मोहारतिदान जगान यो पूर्व वैद्याय नमोस्तस्मै. Respected Dr. N. Shrikant, DDG, CCRAS, Dr. Rana Pratap Singh, Professor, JNU, Dr. Neil Sarovar Bhavesh, Professor, JNU, Dr. Bharti, Director in charge, Punjab Vibhag, CCRAS Institute, Dr. Rupesh Chaturvedi, Professor, and all my dear friends. Today, we are discussing two concepts, Ama and Amaya. Ama is a unique concept of Ayurveda, which now it is very popular in modern science also nowadays. Disease is called as Amaya. Amasya asti iti Amayam. What is Ama? Every day, anything to persist, it has to get nutrition. Food is a basic need for survival of life, whether it's a microbes or it's a grown-up organisms. So, food has to be processed. Whatever there in the food should be assimilated into body parts. That's how body will survive. Otherwise, it's in nature that every cell is going to disintegrate in a matter of time. Shiryate anayana iti shariram. This is told thousands of years before. In the Vedas also it is there. From Vedas, Ayurveda has adopted these concepts. Shiryate anayana iti. So, body is going to disintegrate in matter of time. You need not do anything. For maintenance, you have to give food. So, what is the force that is going to transform this food into a body part? That is what is called Agni. Agni is a transformative force within the body which transfers food, the exterior parts into a body part. So when this process takes place, if everything goes smoothly, whatever is required for the body, it will be transferred into body parts, and whatever is left, it will be excreted out. This is the natural process. But any hindrance in process of this transformation takes place, then causes a indigested, semi-digested or maldigested particle. What is that? That is called ama. So that ama is the root cause for every disease. So in Ayurveda, we say major treatment is the treatment of this Agni. That is, we have to regulate this transformative agent of the body. The Agni is classified into 13 varieties. I think who are from Ayurveda background in this audience group? Okay, only few. See, one is Jataragni that transfers food into rasa, ahara rasa. That will be absorbed. Then it will be converted into body parts through various agnis called Dhatvagni. Every dhatu, every tissue has got its own Agni, its own transformative force that will convert into its part. Then one more Agni is there, that is there both in body as well as outside. That is called Bhutagni. That is the transformative agent within each and every part of the world. That is Bhutagni. It's Vata, Vayu, Akasha, Vayu, Agni, Jala, and Bhumi. These are the Panchabhutas, and all these Bhutas have innate power, that is cellular power. That is called Bhutagni. All these concepts are hidden in Vedas, that has been captured in Ayurveda as a thing which is suitable for the body, understanding the body survival and body disease and treatment of body process. This is called Bhutagni. So wherever, it may be in Bhutagni stage, it may be in Dhatvagni stage, it may be in Jataragni stage, if any malfunction takes place, it leads to formation of ama that will be toxic to the body, and our aim of treatment is to remove that toxicity, to digest it, whether to absorb or to excrete. That is the nature of treatment. So whether this has been, this Amavata, today we are discussing about rheumatoid arthritis. If you see the history of Ayurveda in books, reference of Amavata comes at the time of Bhava Prakasha, around 12th century. Whether before that, that disease was not there, this question arises. For example, if you see Charaka, Charaka describes Vatarakta. Vatarakta is a joint disease which starts from smaller joints and then go to the bigger joints, usually with the Anguli Mulas, Anguli Sandhis. That is because in olden days, the warfare and all those things, people used to ride horses, and because of horse riding, those disease was very common in Charaka's period. But later on, there was a transformation. So then what happens? Disease formation changed. So Amavata is described clearly in Bhava Prakasha, but same was not in earlier books. But Vatarakta also, if you see Bhatta, what are the ama condition? Ama Vata, Ama Pitta, Ama Kapha Lakshana is mentioned that exactly suits with Amavata description also. The concept was there, but predominance of the disease, manifestation of the disease in the form of rheumatoid arthritis was a later point of time. It is because of change in our behavior. Both food pattern and lifestyle pattern and all those things has caused these things. So these things has to be thought well. And what is the treatment? Generally we list out lot of big treatment list. What is to be given in rheumatoid arthritis, what is to be given in osteoarthritis. But Ayurveda does not give long prescription. It gives the concept, what to address. For example, I will tell you my experience. When it was around 2004, I was posted to Lodi Road Hospital for night duty. Patients are taking nearly 20 to 21 medications, different prescriptions for their severe pains. Rheumatoid arthritis cases, commonly they are admitted. And at night, around 12 o'clock, patient is not able to bear the pain and he is asking some other medication from me. What to give? He is already having 21 medication. The concept says, when ajirne veshajam vari. You should not give lot of medicines when there is an ajirna. And root cause for amavata is ajirna. If we say upavasa, we say, what is there? If you say autophagy, you will get excited, isn't it? That's the nature. We are more excited towards the scientific term, so-called scientific terminology. But science is not, depends upon whether it is told in Sanskrit, Tamil, Urdu or English, or in Greek, Roman languages. Science is that which concept which is ever, it will be a truth. So what I thought, see, this patient is already having 21 medicines. If I add one more medicine, what difference it will make? I said, can you stop all the medication? I just gave Saubhagya Shunti Pakam. Saubhagya Shunti Pakam is usually given for the woman after post-delivery. That's the only common sense knowledge of general Ayurvedic physicians. But Shuntyamamatam Janayet Vijayet Guruchi. It is told in Shastra. Shunti is one of the main ingredient which can be used in Amavata. Why? Why Shunti? Why not anything else? Anything can be given which is Amapachaka. So, Saubhagya Shunti I started and patient starts responding. His pain came to control. What is patient is want some relief for the time being. So, how it will come control? Because Ama is there in huge quantity, that has to be settled. Either Upavasa can give relief only when Ama is in the Koshta. When it is in the Dhatu or Sandhi, then you have to see for other agents. So, that has given him relief. Similarly, in some other conditions, sometimes we don't have medication of choice. There are multiple choices for Ayurveda if he knows concept. In another time, I choose Sanjeevani Vati as a choice of medicine. For same Ama, same Shotha Lakshana, same disease, rheumatoid arthritis as per the modern terminology. That also gave relief. Patient used to ask the doctor who is on round in the morning, yesterday night doctor has given something that has given me some relief, you give me that also. And then he will, what is Sanjeevani Vati you have given? And then he used to add after 21, 22. It's not like that. You should stop all the medication because he cannot absorb, he cannot digest. So give simple medication. That is the first line of treatment. You have to avoid excess of food or medicine to the Ama condition. So first is, if possible, first is Ananna. That is Upavasa. That will give the body to automatically take care of the Ama. Otherwise, what can aid for the digestion of that toxic material which is formed in the body. So that is Deepana Pachana. So that is the concept. Whatever you can choose any number of medicines, even hot water is a best Deepana Pachana and it will give relief to the patient. So this concept has to be established, not the medicine. This medication is useful in rheumatoid arthritis. That is of no use for Ayurveda. No use for common man also, because same medicine if you give for 4 or 5 people, one person it will act, one person it is does not act. Why? There are so many factors involved in that. Suppose you are giving curd in a rheumatoid arthritis patient and you give any number of medicine, it will not work. It will aggravate. It's not because of medicine, because of curd. Because curd will enhance Ama. It will destroy Agni. That's the concept. So, concept, established in the concept is the main main research field which we have to adopt. So, just like autophagy has now got the Nobel Award, if we are able to decipher what is Vata actually, what we people call as Vata, in a scientific terminology, so-called scientific terminology. Can you able to picture out what are the factors of vata in a cell? What are the factors of vata in a tissue? What are the tissues which are predominant in vata? If you can able to decipher what is vata, what is pitta, what is kapha in modern scientific tools, that will lead to one more Nobel Prize, and that will influence the entire medical fraternity and all the streams across the life sciences. So that is what is the task for all of us. So my request is, just take inputs without prejudice. This is what is told in Ayurveda, okay, take it as a question. You need not believe. I don't ask, scientists should not believe anything randomly. You should take it as a concept, just a postulate. So you have to verify that in various conditions, whether that postulate suits for all conditions. Then you have to decipher what is the mechanism for that action. So then only we will come out as a research output, and this Center of Excellence in JNU is doing tremendous job, and Ayurveda biology, it has started almost 5 years back, 5 to 6 years back, and this is one of a unique concept. And if we develop this, we can make entire scientific medical fraternity and all life sciences to be dependent on this concept. So this has a potential to influence entire research field across the biosciences. So I request you to put your heart in this your research and come out with the validation of the Ayurveda concept, which will benefit to the all humankind. Thank you all. Namaste.
Thank you so much, sir. Now I would request Professor Rana Pratap Singh to present a memento to Dr. Kaustubh Upadhyay. I would request Professor Rupesh Chaturvedi to present a memento to Dr. N. Srikanth. I would request Dr. Neel Sarovar Bhavesh to present a memento to Dr. Bharti. I would request Dr. Neel Sarovar Bhavesh to present a memento to Professor Rana Pratap Singh. Thank you so much, sir. Now I would request Professor Rupesh Chaturvedi for the vote of thanks.
नमस्कार, सुप्रभात. Vote of thanks, it's the most difficult part of any session because there are so many people who has contributed and we really need to thank you. मैं अपना सबसे पहले कृतज्ञता ज्ञापित करना चाहूँगा देव धन्वंतरी को जिन्होंने इस विजडम को क्रिएट किया. कृतज्ञता सो करूँगा मनीषी और ऋषि परंपराओं के चिकित्सक जिन्होंने इस विजडम को परिष्कृत किया और हमें ये प्रदान किया जिस पे कि आज हम एक डिस्कशन कर रहे हैं. मंच पे आसीन हमारे अतिथिगण, Professor Dr. Kaustubh Upadhyay ji, N. Shrikant ji, Bharti ma'am, Rana sir and Neil Bhavesh. आप सब लोगों ने अपना बहुमूल्य समय दिया और अपने विचारों से हमें परिष्कृत किया। प्रोफेसर डॉक्टर उपाध्याय जी ने बड़े सुंदर शब्दों में आम, अग्नि और जो डिजीज़ है उसके बारे में बताया। इसके लिए सर आपको बहुत धन्यवाद। हमारे स्टूडेंट्स जो यहाँ बैठे हुए हैं, जिनको कि इस चीज़ के न्यूआंसेस को समझने में बड़ी आसानी होगी। जो आपने केस स्टडी बताया कि किस तरीके से सिंपल एक ड्रग जो है वो दो लोगों में एक तरीके से नहीं बिहेव कर सकती है, और इस पे रिसर्च के लिए आपने हमारे स्टूडेंट और पार्टिसिपेंट को जो एक फूड फॉर थॉट दिया है, उसके लिए धन्यवाद सर। श्रीकांत सर, आप हमेशा से हम लोग की एक व्हाट वी कॉल इट इन like you have been a champion for us. You have always become you are the champion for our, whenever we approached you, you have been very, enthusiastically you always say, let's do it. It seems like it has some values. और आपने जो आज सुबह हमारे सारे स्टूडेंट और पार्टिसिपेंट को कहा, बताया कि किस तरीके से we don't need to validate this wisdom. What we need to do is we need to understand this wisdom. That's very important. I think we are going with, we all must go, इस सभागार से बाहर निकलने के बाद इस थॉट के साथ हम बाहर जाएं कि जो आयुर्वेद का विजडम है, जो नॉलेज है, we don't need to validate. What we need to do is we need to try to understand ourselves कि what they really mean. फिर भारती मैम, आपने जो एक क्लिनिकल प्रोस्पेक्टिव स्टूडेंट्स को बताया, वो भी एक हमारे स्टूडेंट्स को जो कि मॉलिक्यूलर बायोलॉजी, आयुर्वेद बायोलॉजी या दूसरे विधाओं से यहाँ पे हैं, उनको भी एक पिक्चर पता चली कि किस तरीके से आयुर्वेदिक clinical is pretty much similar what we see in modern medicine, especially if you look at the rheumatoid arthritis. Physical appearances, if you look at what has been described in Ayurveda, is pretty much what we see into the common, in a modern medicine. Differences is how we diagnose them. But there is a common convergence point between both, how they diagnose it. So ma'am, thank you for that. I think hamare participants, they are going to take this also to home with that. Rana sir, who is our leader, and in his able leadership, we were able to get this COE. He has been a constant inspiration for us, trying to break silos. He is the one person who really bringing us all together, molecular biologists, Ayurvedic biology, Ayurvedic people, Neil, who's a chemist, but we all have come together. Hemant, who is our computational biologist. Pallavi is not here, she's another person. And he is the one who is gluing all us together and trying to provide you different kind of out-of-box solution to these problems which we are trying to do together. Neil, especially for this program, he immediately agreed to host in ICGEB. Thank you, Neil, for that. We really appreciate. It's a nice hospitality here, and for the whole throughout the day, you are going to enjoy it. I would like to, if I don't thank our students, volunteers, it won't be a justice. They are working tirelessly. Most of us were, last night, 2 days back, we were in a Rishikesh participating in another conference. But just in a one day, they came, they all worked, and we were smoothly and seamlessly, we started our program. I would like to thank ICGEB, Professor Ramesh Sonti sir, director, who graciously agreed to host us. And in the evening, he has promised that he has in the morning hours, he had a meeting, but he said in the evening valedictory session, he will be present and talk to us. Mr. Biju Matthew, Administrative Officer, Ravindra Ravi, Manager IT, Naresh, Manager Component, Sweta Gupta, Sachin Mehta, Mayank Gupta, and the ICGB Administration, Housekeeping Staff, and Security. You know, these people are working behind the stage to make this successful. Thank you again, and if I don't thanks my participant, as well as the esteemed guest, they all came here in the morning. Thank you very much. Thanks, and I'm looking forward for fruitful whole day discussion. Thank you.
Thank you so much, sir. Now I would request everybody to move out in the front lawns. I'm sorry. Please stand up for the national anthem.
गणमन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंग विंध्य हिमाचल यमुना गंगा उज्ज्वल जलधि तरंग तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे जनगण मन.
Thank you so much. Now we'll proceed towards the front lawns for the group photograph, and after that we'll go to the for the tea break. Thank you.
Second thing, after the tea break,